Hello, everyone. My name is Stephanie Reardon. I am the Director of Patient Programs with the Every Life Foundation for Rare Diseases. Part of my role is managing the Rare Artist Program, which is a program to be able to tell your story and advocate through art. Part of the program runs specifically by our rare artists and the rare disease community themselves by making sure that we're providing tools and resources for the community. And that's exactly where this webinar stemmed from, of making sure that we are providing tools and resources for accessible creativity, of making sure our artists know that there are ways and opportunities to continue telling your story and creating art throughout your rare disease journey. So excited to have you all here today and hear more about that. For today's webinar, if you prefer to dial in, you can do so. There is a phone number on the screen as well as a webinar ID. If you would like to ask a question, please type it into the chat box and a member of our team will answer the questions. We will also have an open Q&A and a share session at the end. So if you have any questions, I do suggest holding them on until the end. However, if you have something that you want to ask right away, feel free to ask. Just a reminder for the media, as with any of our webinars, any media that are in attendance, please formally announce your participation, refrain from quoting any of the discussion of the webinar during the actual webinar, and we encourage you to follow up with any of the participants after the webinar for direct quotes. Closed captioning is now available in real time for all meetings. Please click the live transcript button at the bottom of your window to begin the transcription. I am so fortunate to be joined with such wonderful artists and advocates here today. Starting with Adair. Adair is a 2021 Rare Artist Awardee for the piece Raw Canvas. I almost missed it. Raw Canvas. Adair is a disabled and non-binary classically trained artist. Megan Howard is a 2015 Rare Artist, so very exciting. Megan has been with the Rare Artist community for almost 10 years now. Megan was also a finalist in 2023. Megan has a master's in art therapy and counseling. We have a very special guest, Miriam Zims, who is a board member for the National Organization for Arts and Health. And then, as I mentioned, I introduced myself. All of our amazing panelists will be able to introduce themselves in just a moment as they begin to share their story. Today, our agenda is a welcome by myself, and I will share some exciting tools that we now have. You'll be able to hear from all three panelists. We do have a reflective art activity that will be led by Miriam. As a friendly reminder, if you don't have your supplies with you yet, we suggest grabbing them. That includes a pencil, a pen, a 4x4 paper or sketchbook, and a scrap piece of paper any size. And then at the very end, we will have an open Q&A and share. For those of you who are unfamiliar, Rare Artist is a program that was established in 2010 to allow those impacted by rare diseases to tell their story through visual art and poetry and powerful artist statements. Each year we have 20 finalists, and our finalists participate in Artist to Advocate coaching to tell their story with myself to really strengthen their artist statements and ability to advocate through art. The annual contest is open for submissions every summer. Awardees are invited to showcase their artwork during Rare Disease Week on Capitol Hill and also receive a cash prize. If you look to the right of the screen, this is our friend Seth. Seth was a 2023 Rare Artist Awardee for the piece that you see right on the top here with his brain. Seth was very creative and actually made t-shirts with his mom of his artwork. And his mom was also a Rare Artist Awardee about 2 years before. Very exciting to see that they are staying in the Rare Artist family. Seth met with his senator from Alaska to be able to share his story and share his art piece and advocate through that art. If you are interested or ready to enter Rare Artist will officially open on August 1st at rareartist.org, and we will accept submissions through September 13th. And I want to give a huge shout out to Savannah Coggins, our patient programs intern, for putting together a brand new resource guide that it's actually now available on our website at rareartist.org. We just uploaded it. It is an accessibility tools and additional resources for artists guide. So this toolkit includes different resources for technical computers, captioning, physical art resources, accessibility resources, and additional resources. Thank you to all of our members of the panel today for contributing to that, and for anybody who put in additional resources when they registered for this webinar. This resource guide is an ongoing document that we are able to update and change. So as we go through the webinar today, if people are sharing other resources that are not on this guide, we are happy to add that and make sure that this guide is something that is accessible and available for the community. With that being said, it is my absolute honor to introduce Adair.
Aloha, everybody. My name's Adair, they, them pronouns. I am a disabled trans and queer artist. First and foremost, Stephanie, thank you so much for having me here. It has been a delight getting to meet everyone. So I am an artist, advocate, mentor, collaborator, and king of adaptation. Next slide. Yeah. I have Ehlers-Danlos syndrome. I was diagnosed at the tender age of 46 years young. Even though I had these crazy things like I couldn't crawl as a baby because of my hip, I had double hernias, I passed out all the time. So as we know in the rare disease community, it takes time often to get a diagnosis. Next slide, please. First and foremost, I want to talk about being an artist, being a creative, finding ways to be able to do the art despite our challenges. I myself, I'm a professional artist. I showcase nationwide. The painting on the right-hand side is a close-up of my partner, oil on wood. Next slide, please. So finding ways to do art. Even if you're having challenges, all of these paintings here, I was having challenges with. My hands give out from time to time. And the two paintings on the left-hand side, I couldn't do detail anymore. So I found myself just going in and playing with bright colors and helping my mental state by painting a light breaking out of the clouds, out of the darkness. And I did this for probably a solid year. I just painted these little itty bitty starbursts, and that helped me get through a really rough period of my life. The next time my hands gave out, I went back to using tape and rulers and bowls to make simple shapes because I didn't have the coordination anymore. And then I'd put gloves on and I would just play with modeling paste, which is the textures that you see there. And it was like playing with Play-Doh almost. And it gave me the freedom to just be creative, play, and give me something to focus on. And because of that, I learned a bunch of new skills. The paintings on the right-hand side, I used to paint 14-foot huge paintings. The one on the upper right is one of the 14-foot ones. My hands no longer can do that. So now I paint about maybe 3 inches, something to that effect. You can see that, the size of the little bird, right? I recently had 13 surgeries on this hand and 10 on this, so they're working a little better. Point being is, if you're limited in one way, find a way of using those limitations to still be creative. Next slide, please. Next slide. The next slide, I believe, is about being an advocate. There we go. Thanks, Stephanie. I work with 6 different advocate programs, including Rare Artist. And one of my favorite things to do, especially when I'm having a challenge with being able to use my hands or create art, is to volunteer. Now, only do this if you have the spoons, if you have the energy to do this. Next slide, please. I got the chance to be a 2021 awardee with the Rare Artist program, and honestly, it changed my life. If you get the chance to do this, by all means, I got to be a judge last year. I've had the chance to meet up with my senators in Washington, to do speaking engagements, and to be able to highlight disability and art. The oil painting on the left-hand side of the photo is a self-portrait that I did. And at the time, I didn't have my diagnosis. I did the painting and I thought it was odd how crooked I was, and my muscle mass was different than normal people. Later on, when I got my diagnosis, it all made a lot of sense. The penny dropped, as it were. Next slide, please. Being a mentor. So at times when I don't have the ability to create, I still have the ability to communicate. So what I do is I share my knowledge, and even if you're not a professional artist, you can teach kids, you can teach anybody, you can go simple. Also, if you have space, share your space with other creatives. That's also another way that you can still be in that creative environment. Next slide, please. Share your journey through writing. So the picture on the upper right-hand side is the book from Ikui, and it's inside their studio, and it's a compendium of artists sharing their studio and their workarounds as disabled artists. The book on the bottom is 23 of my large paintings, and I think 1/3 of them showcases disabled people living different lifestyles. The next two books, Art Tips and Tricks and The Resilient Artist, are books that I'm currently working on. The last being um, disabled artists in the workspace and also the workarounds. How do you do the things if you have limitations, right? So you can do a whole book from bed. You can dictate it straight on your phone. So if you find that you're not able to get out in the studio or to create, you still have the option of, again, sharing your knowledge, right? You can do memoirs. You can do children's books. It's really, that's a neat way of adaptation. All right, next slide, please. Be a collaborator. Okay, this is one of my favorite things to do as a disabled person. So all these pictures here are different collabs. There's about 4 of them on the island where I live. I live in Hawaii. Aloha, everybody. And the 3 pictures in the middle row are some of the artwork that we've done as collaboration. So we work together on one piece to make a piece that we wouldn't normally be able to do ourselves. Next slide, please. So collaboration, art, why? Well, one, it helps break isolation. You're around other people. You're also around like-minded, creative people. You get to learn new skills because people are showing you what they know. You also get to share what you know with those around you. You can also, big point here is have help with your art projects. Others can be your hands, your eyes, your energy, right? You have access to different skills from other people, and you have help with any challenge that you might come across. For me, it's always, please open my paint can. Get into doing collaborative art. And you can ask me questions about this later if you want. Next slide, please. Be a king, queen, rock star of adaptations. Own that stuff. So upper left-hand side is my phone. I've got a thing that lets me hold it and not grip it, but it's kind of a, yeah, it's just a great workaround. It also has a magnet, so I can put it on things so I don't have to hold my phone. You'll see here a bunch of braces. I've got like 43 different braces for my whole body. I also have large computers, and I have a Wacom tablet so I can do art on the screen. I also have a dog grooming table. That's on the bottom left-hand side. It raises so I can sit and do large paintings without having to go on a ladder. Dog grooming tables are a lot cheaper than hydraulic lifts, by the way. And then I just always tape paintbrushes to my finger because I don't have finger control. Next slide, please. Know your limits. How many spoons do you have? How much energy do you have? Do you need to set boundaries for other people or also for yourself? Be preemptive, meaning I've got six things that are diagnoses that are going to cause blindness at some point. So I often walk around the studio and ask myself, what if? What if I'm blind? How do I paint? How do I sculpt? How do I navigate? And I set things in motion preemptively. I'm super bendy, so I always have to catch myself in poses like this. And I love woodworking. It's one of my favorite things. But now I have to have others do it because it's not good for my hands. So again, know your limits. Next slide, please. And the next slide is just owning it. Like if you have your braces, if you have your cane, your wheelchair, your support systems, just unapologetically use it, wear it. Don't worry about what other people think. Most people think that, for me, it's a fashion statement at this point. Go fig. Next slide, please. And then if you can't do something you loved, find a way to incorporate it into your art. I used to be a fire spinner, can't do it anymore. So now I paint with soot and fire, and it still gives me that exhilaration. Please, next slide. Find your online community. So TikTok, Instagram, Facebook, YouTube, they are great for following advocates and inspiring rare disease personalities. If you have EDS life hacks on Facebook, amazing. Next slide, please. And the best thing I can leave you all with is be patient, kind, gentle to yourself. Please, please, please. There are no mistakes, only happy accidents, as Bob would say. And if you want to say hello to me, my info is adairart.com. My Insta and Facebook are adairart. And thank you, truly, everyone, for being here. Aloha, Stephanie.
Thank you so much, Adair.
Yeah.
All right, and Megan, I'm going to pass it over to you.
Thank you. So yes, my name is Megan Howard, and my self-image description, I am a female in her late 30s with medium length brown hair, wearing glasses, sitting in my hospital bed with a blurred out background. Next slide, please. You can go, oh, thank you. I have loved doing art for most of my life and have found art to be a great outlet from a fairly young age. Next, please. My rare disease diagnosis started out with a diagnosis of Behçet's disease at age 19, although symptoms trace back to when I was a young child. I was later diagnosed with autonomic neuropathy, POTS, and idiopathic hypersomnia. And my doctors also think I probably have chronic regional pain syndrome. Next slide, please. I decided to pursue an education in art therapy counseling where I could give back to others going through some type of health issue. And I actually got my first choice of internship at Comer Children's Hospital in Chicago, where I got the opportunity to work with children with all kinds of medical issues, including many with rare diseases. These 5 pieces of artwork shown are reaction pieces to working with one of the clients at my internship. Next slide, please. Unfortunately, as I got more ill as I was graduating from school and eventually had to put my new counseling license on hold due to what I later learned to be the onset of autonomic neuropathy secondary to my Behçet's disease. I went from being able to walk several miles, not without pain, to needing a walker or wheelchair, not being able to keep food down and requiring a feeding tube, having severe GI dysmotility, and eventually requiring a colostomy bag and catheters to urinate. The pictures shown are pictures of me back when I was getting that diagnosis in the hospital. Next slide, please. So what if I'm not feeling well? Do I still make art? Yes, if possible. While there are times that it's just not doable and I need to focus on rest, there have been many other times over the years that I feel art has saved me. When I get severe pain and I've done everything else that I can to help the pain, I distract myself by getting lost in my art. I even named a recent drawing Helpful Ostrich, as I drew it during a bad 5-day bladder pain episode. This artwork is shown on the left with a screaming ostrich and a very colorful background. Next slide. But sometimes it's just too difficult. For example, I had surgery in April and I had such severe pain, trouble sleeping, and migraines that I did not feel like I could pick up my sketchbook until I finally could. And every time I would start drawing, my IV pump would start beeping. And in that case, I used a pre-colored watercolor page as soon as I got home while it was still fresh to express what I'd been through. The artwork on the left is this artwork, and it shows my excision site, G-tube, J-tube, colostomy, and many words associated with a difficult hospital stay, like help me please. Next slide. Rare Artist 2015 awardee. During one of my worst medical and hospital experiences, my nerve pain was worse than I could describe with words. I began drawing nerves and attempting to visually describe and tell my story. Once finally home and feeling strong enough, I revisited what I'd started and overlapped it with a second drawing, ultimately entered it in the Rare Artist contest in 2015 and won. It's always good to create in the moment or as soon after as possible to really capture what you're going through, but don't be hard on yourself if you can't or don't meet your expectations. The artwork Screaming in Pain is shown on the right. This is the one that was entered in one in 2015. It shows a person with their hands on the side of their head screaming with many nerve-like images throughout. Next, please. Telling your story. I found the Rare Artist contest to be the perfect opportunity to get my story out there. I was able to get my story published in 4 publications, including the front page of the Red Eye, Chicago Tribune's free paper, and on everydayhealth.com, which was featured on AOL.com. It was really exciting to see the impact of my efforts. And one of these publications are shown here on the left. Next, please. Advocating. After my artwork was selected in 2015, I also attended local RDLA meetings with Senate. I was in Chicago at the time and was invited to an event at the local hospital where the director of the NIH, mayor, and senator were speaking, mostly to hospital staff. I had a moment to speak with the senator and actually got him to say he would take another look at and reconsider a bill that he had already decided against. Pictured is a picture of a hospital. Next, please. Adaptations. I'm volunteering my time and energy today to share some ways that I've overcome and worked around my physical limitations, because I love Rare Artist and I want to share some things that I've found helpful along my journey. I am mostly bedbound and do 90% of my art in bed. I always have a sketchbook within reach, and paint markers have become my new best friends. They give me the freedom to paint from bed, which I normally wouldn't do because I'm prone to spilling. But I would encourage everybody to try different brands of paint markers, as they do vary quite a bit, but I have listed my favorites in the resource list. Shown on the right is just an image of paint markers. Next, please. Adapting from glass flame worker to fuser. When I am able to get out of bed, I love working with glass. I originally worked at a torch making beads, but started getting too much pain to keep my arms in the air, so I switched to making fusible glass that I melt in a kiln. Making glass art motivates me to get out of bed. But I don't have a lot of energy to stay out of bed for very long. But if you can do anything, just a little any day that you can. It's better than not being able to do any at all. I find I do as much as I can from bed. Like if I'm making jewelry, I put the jump rings on, I make cards for displaying the jewelry, I price items and anything else that I can from bed. Pictured is a publication. On the left, it shows me flame working, and on the right, cutting glass for fusing. Next, please. Other adaptations. There can never be enough table space around my bed. I personally use a bedside table and other tables parallel with my bed, a headboard with shelves, a rotating table tray with handle to assist out of bed, and a reacher grabber within reach in case I drop something and don't want to ask for help or get up. Pictured are some examples. Next, please. More adaptations. Smart lights and smart displays are amazing. They allow me to turn lights on and off by voice command, which allows me to be more independent, to turn lights on and off without getting out of bed or wheelchair. And it is a great help to be able to dim and brighten lights. For example, if I'm having a migraine, I may want a very dim or no light, but if I'm doing artwork, I may want really bright light. And smart technology is great for anybody that has a disability. There's more detailed information in the reference list, so please do check that out. Next, please. Adaptations that I used during my art therapy internship. We'd always give the patients many choices so that they would have some control over their environment, which they did not have over their disease or hospital environment. One of my favorite things, we would make cardboard easels for the kids to paint in bed, especially if they were in an isolation room where we couldn't bring materials back out later. And nobody could not participate in art. Even if they weren't able to do art physically, we would have them be the director of a painting, drawing, or sculpture. For example, if they had really bad burns and they just weren't able to participate in the traditional standard. Working with kids having seizures would just take away the materials to keep them safe if they started having a seizure. And taping a brush to their finger if they couldn't grip or were wearing a brace that got in their way. Next slide, please. And in addition, we would do artwork with medical supplies with them to give them a more positive experience with some of these things. Some of my favorites were the medical sock puppets, syringe buddies, and gauze dolls that we would make for the patients to paint. Next slide, please. So final tips and tricks for me: be creative about being creative. Find workarounds that help you create. Make art, it's healthy for your well-being. If you are stuck, try a scribble drawing. Spend 20 to 50 seconds blindly scribbling on a blank page. Try curvy, looping, or zigzag lines. Then look at these lines and find images within, like looking at clouds in the sky, and make these images more distinct. Try using markers on these scribble drawings to paint over any unwanted marks. And as you can see, they can be very simple to very complex. Next, please. And thank you for being here and allowing me to talk with you. If you'd like to connect with me, Instagram or Facebook are two great ways to do so. Thanks.
Thank you so much, Megan. Miriam, passing it to you.
Thank you. Thank you, Stephanie. It's been great to have this collaboration with Every Life Foundation and the Rare Artist Program, and with Adair and Megan, so much that we have in common with the rare disease and the disabilities from our diseases that have come. So thank you. I just want to also self-care describe who I am. I am a Latina with a lower body physical disability. I have dark hair, I have chocolate colored skin, dark eyes, and I'm a 5'2" petite dynamite, as some people say. I enjoy singing, movement, and the outdoors, and I'm the freest when I'm swimming, petting my tortoises, and viewing our prickly cacti. I'm from Lutz, Tampa Bay, Florida, and I'm on the land of the Minnesota and Timucua tribes from the Paleo-Indian era here in Florida. Next slide. So I came to the arts after a successful 22-year career as an environmental consultant across the United States. I was creative when I was younger and did a lot of really cool things, but I pursued business. And I ended up getting triple negative breast cancer at 43. And that began my journey with the Arts and Medicine Studio and my life in the arts at Moffitt Cancer Center. And then I received a second cancer within 3 years. And just finishing up my breast cancer diagnosis, I got chondrosarcoma in my pelvis. And that required my left pelvis, my hip ball, and my left femur to all be removed and rebuilt. And wonderful, wonderful that both in triple negative breast cancer and in chondrosarcoma that I was left alive, and I'm 14 years out, 11 on the other. And, that's a miracle. But we're often left with, as I was, with two rare diseases and, that I still hope don't come back, and a disability. I'm also BRCA carrier, and that led me to have a third rare disease because of the genetic implications of potentially having a third cancer, which would be brain cancer. So the arts played a critical role in giving me a new purpose in life. Next slide. So expressing through the arts. I'm an emerging artist. I didn't come the traditional way. I learned the healing arts, the expressive arts, the Zentangle art method, which we're going to do in the reflection. And so I use art and have from 2013 on as a daily practice, as a way to express and not to share some of this art. Like, this is not art that's gone in any gallery show. This is the art that I use to express and release the story of pain, resilience, and hope into every stroke for my own well-being, my own mental health. And then I'll talk a little bit more about the gallery components of how I have become an artist through the healing arts in just a minute. But it has become a lifeline for me on a daily basis with all the things that I currently struggle with finding new abilities. And this is one of them. Next slide. So the artist is the square on the left, and I learned a line drawing form of art, and that's where my passion is, with adding color and expression and writing with it too. And on the right, I've also become a teaching artist. And I'd say somewhere in the middle is how I became an advocate from day one, both as a patient, an artist, and a teaching artist. And I'm allowed in this new life to advocate for the healing arts, arts and health, my role in NOAA, in Florida, in all different ways through those avenues. And I couldn't be more grateful, for example, for partnerships today and how Stephanie and I connected through the National Organization for Arts and Health. So advocacy is an everyday part of my life. I often tell people that 33% of my life is maintaining my health, so I'm not back in a wheelchair again, dealing with chronic pain, or extending when I'll get back in a wheelchair, I should say. And 33% is arts and health, my arts and health life, everything that you see here. And then 33% is obviously my life with my husband, our children, our tortoises, and different things like that. So that's how my life is broken up now after a very successful business career. It's a new, exciting life. Next. Let's talk about disability. With rare diseases often comes from the surgical side effects. We often get a disability. There's the legal definition, and I've put at the bottom the source to introduce folks to the ADA. I felt immediately I needed to understand what that meant for me. I knew that I needed to understand the legal definition. I realized having prior to 43, I had a non-disabled life and non-rare diseases. And then I was moving forward for the remainder of my life with this disability. And there are things that are seen and unseen. People see you or unsee you differently. I'm the most seen when I'm in my wheelchair. I'm the least seen when I have my cane. Attitudes and perceptions. People have those about how you might look on the inside, not knowing that I've lost both breasts, my fallopian tubes, my ovaries, my left pelvis, my left hip ball, and my third of my left femur. Those are all various female body parts that are lost. But if you see me on the outside, or those of you that I know that I've seen here on the call today, you don't see that on the outside. So what does that mean? I have to take action. I have to take action in the sense that I'm a student and a facilitator, and that means I have to communicate reasonable accommodations. And the words I always use about communicating reasonable accommodations is be calm, be firm, and when you're not heard, put it in writing. And putting it in writing really changes the game of what attitudes and perceptions and allow you to be seen. And it's very powerful. Next slide. So here is where the consultant in me comes up. So one of the ways I advocate is I've made a version of this presentation at for various associations. And I'm so happy to be here with an association for rare artists and one that focuses on policy too. As a student, as someone who wants to build my craft as an outsider artist, emerging artist, I need a clear understanding of the class. These are the questions that I ask. Technical service, it's always important to me if the class is going to be recorded. I may not be on my game. I may be in significant chronic pain. I live in a 5 chronic pain. Recently, I had a fall and I was for 8 weeks in the 8 and 9 level. I'm not necessarily going to be as present in that area. Technical tools for students. These are things I share with teachers to help teachers that are teaching me a better craft. And I speak up in a calm and firm way about ways they can learn about setting up classes for teaching someone like myself. Communication for clarity and introductions. By telephone, by email. Get on the phone, ask questions with classes and art classes that you're taking, communicate what you need. If I can't take the live class, do you offer it in any other way or another time? Next slide. I'm only going to go through in the next slide, next few slides, 1 or 2 points, because there's a lot of resources here. So Arts for All Florida, this is the organization that changed my life and put me on the map as an artist in health in 13 galleries in the state of Florida. I've done commissions for them. I've done teaching for them, or facilitation as I call it. And in those environments, I've had to learn how to also teach my peers who also have an unseen or seen disease or an unseen or seen disability. And so they've been a lifeline for me, and they are such a compliment to what the Every Life Foundation is doing from a policy perspective and also rare disease. So next slide. They're a great resource and a model program, I believe, for every state. Resources on assistive technology and adaptive art. The one I'm going to go to, because you can go through to these slides, these links, because they're active links and there's a lot, is Zoom. So creating accessible meetings. If you are a facilitator or an organization or a teaching artist, this site provides, it's called Disability In, provides great resources on how to make your Zoom event more adaptable and accessible. I encourage you to go there. Next slide. Resources part 3. What are the national support programs that are out there for all of us, similar to Every Life Foundation and the Rare Artist Program? National Endowment for the Arts. They have accessibility publication, checklists, and resources. The VSA, the Kennedy Center for the Arts, obviously, we all understand why, with the Kennedy's support of many programs regarding people with disabilities for years. The National Arts and Disability Center, and then the Tennessee Arts Commission, I put here, Arts Expedition, is check and see what your state has. Here's Tennessee's. I mentioned Florida and the way in which it helped to put me as an artist who everything I do is communicated about the healing arts. My art, the bio, everything tells that story. So people learn about arts and health through my art and through my artist bio. Next slide. I believe this is the last part 4 of the resources, the ADA website. Digging deeper, the ACT, accessible technology, technical assistance publications, it's all there. And with this and this particular, all of our presentations and then the resources document that Every Life Foundation is putting together is going to be a powerhouse of sharing how we can all be a community, adapting, becoming accessible together. This video, I just encourage you to check you out. It's my last day of Spalding rehab. Took me 2 years to sit up, stand up, and walk again, and I was in rehab every day, which is why I did 300 pieces of art, because I was pretty much immobile. But this is a hand dance that I taught to all the staff at Boston and Spalding rehab. It's just fun. If you want some fun sometimes, check it out. Next slide, and rounding it out here. Body, mind, and spirit. We're about to go into a reflection art piece. It's such an overused words, body, mind, and spirit. The body is physical. What are our limitations, if we have any? And if we do, how do we adapt? Our mind, it's really our brain. What is the cognitive energy that we have? I am not the same person that I was, 14 years ago before all this has happened. My body has seen tremendous, as many of us here have expressed, impacts, trauma to it itself. And then the emotions, and I'm talking about here mental health. How do we deal with all the things all of us have been talking about, and the worry or what's next or the next surgery or what if? We all have these. And I just want you to write, if you have a moment, what you feel that one of these words mean to you in the chat. What does body, mind, or spirit mean to you? I'd love to see some interaction. Next, and before we go to the next slide, this is a piece that is 3 foot by 3.5 feet. It is the story of all my female body part losses, including a miscarriage and some IVF failures. But this is called I Am Alive, Life's Blood Flow. Next slide. It's a reflective piece that did make a gallery. So while I was at Moffitt in the Arts and Medicine studio, where I began my journey in 2010 as an artist, who would think I would even say that as a former business person writing Excel spreadsheets and technical reports? But this method captivated me among the many. It is a meditative art. It's small and portable. It's called Yoga for the Mind. It's a no mistakes art, only opportunities. It's non-prescriptive. I wasn't an artist, but I wanted to create. I wanted to express. I wanted to explore, and I wanted to sing. And it has allowed me to realize my full artistic self, and it's meditative. So I'm going to ask you to pull out your tools, your pencil, your pen, and your paper, and your scrap sheet of paper, and we're going to do a short 10-minute exercise on the Zentangle art method. And if I could have the shared screen, I'll turn my camera on. My overhead projector. I hope you all can see. Okay, so I'm going to quickly go through the method. You had a handout which will give you that information on a more succinct level, and I can't go in details, so we stay on time and let Stephanie bring us home with some exciting rare artist information. So you're going to take your pencil, your sketchbook, and your piece of paper and your square, and you're going to put a dot in each corner. For those of you that are my generation, if you love connect the dots, you know what I'm talking about. So I've lightly put a pencil dot in each corner. Now I'm going to connect each dot. Not how you're feeling today. If you want to do a whimsical connect the dot, left to right, top to bottom, or do you want to do a straight line as best as you can do it, no problem. Now let's take a look at this piece. Doesn't that look like a wonderful square pizza? Well, we need our pizza sliced, right? So we can process our art and do something fun and creative. So let's make a Z string, or we're going to slice our square pizza into the letter or alpha stroke, as I like to call it, Z. Start anywhere in the middle or somewhere on the left side. Come up, come down, and go up and over. So that's kind of a Z, call it the Z stroke. Now within our slice, think of each pattern or tangle that we're going to add here using various line strokes. If you want to quickly pull out your scrap paper, I just want to show you what those line strokes are. Or vertical line, horizontal line, diagonal line. Orbs, and orbs can be done in all different sizes. And since we don't have anything to make us a perfect circle, we call them orbs. And then the alphabet letter strokes or alpha strokes is an S and a C, or a form of it. These are the only strokes you need to do to draw anything. And I'm going to tell you, I've been in gallery shows and been awarded art. I'm sorry, I've won some art contests. If you would have told me that before, I would have never believed you. This method has helped me to also become a more established artist. Okay, so the first thing we're going to do is we're going to work through with the S, the alpha S stroke. So let's take this piece here, this quadrant, your largest one, and let's just do an S stroke. Okay. No judgment. This is a no judgment art. We are here to reflect and express. The end product is just something happy we'll get at the end. And I want to ask you all to breathe. We're going to repeat this line or the stroke right next to it. Now I have to wear a brace now on my hand. I'm having some problems in my bone now in there. And so this art has taught me to let it go, and the mistakes are a blessing. So now we're going to take our C stroke and we're going to add it along the left line. Okay. And we're going to rotate your sketchbook or your piece of paper and continue to add more of these C strokes. Let's do some on the other side too, on the right line S curve. And I apologize for working fast. I want you to just get a full experience. Technically, there would be instrumental music playing, but we're not going to do that today. Now, let's do some line strokes that just repeat the previous line. So just spend a few seconds repeating the strokes, the line strokes that you see, or whatever comes up for you. I always say, if you're not feeling this, do something that you want or write inside of there. Express through reflective writing. Zen tangle, or as I like to say, the tangle is the pattern. So we're trying to find the Zen in the tangle. So we've got one slice of our pizza with something in it. I encourage you to try drawing large or drawing small, whatever is the opposite of what you're used to. And if you've never drawn again, or excuse me, drawn before, that's okay too. Okay, let's all take a deep breath. Intentional breath. That means you're going to hear your breath. Breathe in and breathe out. Don't forget the power of breath. Now, if you finish there, or you can always come back to this piece, let's work with the orbs. For those of you that either eat cheese, non-dairy or regular cheese, Swiss cheese, vegan or not, dairy or not, always comes about with those beautiful orb holes, right? So let's make a few orbs in one of the, and you can choose whichever slice you're in. And my apologies if I didn't mention that I'm working in pen now. If you're working in pencil, don't stop. You're going to be able to go over it later and have another little 10-minute break. Fill in your Swiss cheese with more little orbs. And continue to fill up as many as you want to. Take the next minute to finish filling in with orbs or finish filling in with lines over here. And fill in until you feel complete or whole. Revel in the silence. So let's finish up our piece. And I want you to write somewhere in one of the other open spaces. I want you to write, you're going to fill in the blank and just choose one, whatever feels right for you. I am, and stick with your feelings. Whatever comes up first is correct. Don't let your mind start, well, I'm not, just think I am, reflect on that, or I feel, reflect on that, fill in with a couple of words or one word, or I need. Ten minutes is all you need every day, 15 with your strokes to have quiet time. You can look up the Zentangle Art Method, which I learned at Moffitt Cancer Center. It's a part of my daily practice, as is writing, and it helps me with insomnia from a very long time of being on heavy pain medications for 7 months, 24 hours a day. And so insomnia is what I'm left with. Thank God that's all I'm left with, but it helps me to slow my mind down at night. I want to thank you for being here. And I want to turn it over to Stephanie for the next part.
Wonderful. Thank you so much, Miriam. That was absolutely wonderful. It sounds like you have a fan club in the chat already. I think you put some very key portions in. A lot of times when people enter Rare Artists, they will come to me and say, I'm not an artist. And I think all of us can understand you are an artist. You were the one that owned your story. You were the one that can speak your story. You were the expert in your story, and finding any way to be able to tell your story and be able to share your story, even if it's just by starting small and doing a meditative, reflective exercise, as Miriam is doing, is great. Meet yourself where you are. I see somebody in the chat mentioned about being a type A personality, and I get that. And some of you may have been on Global Gene's webinar yesterday, and we talked about how many times when you're first diagnosed with a rare disease, you're thrown so much medical jargon and so much medical terminology that art really allows you to take a step back and process it and understand it emotionally. And make sure that you do that. Make sure you do that to tell your story, and think of that when your voice wants to tell you you're not an artist. You are an artist because you have that story. With that all being said, we have a few minutes left for some Q&A. I'm going to remove my spotlight. I saw one question that I thought was great in the questions earlier. After Adair spoke, Susan asked, after you dictate on your phone, can you print that? Susan, I don't know if you want to clarify that question, or Adair, if you want to speak to that at all.
Yes, actually, you can. Oh, so go right ahead, ask the question.
Well, my hands get very tired, and I am a horrible writer. My handwriting is very bad. And so I had asked when I was in the hospital because I wanted to write my story, but I can't do it. And so I was looking for some kind of a voice dictation that you could actually voice dictate it and then actually send it to like your computer and then print it. So, or that you can kind of edit it for a book down the road.
Yeah, so there's a few things. One, if you're working with a computer, there's something called Dragon Speak. I think there's also another Apple Speak. Dragon Speak only works for PCs. It doesn't work for Macs anymore. They discontinued it, sadly. If you are working from your phone, and I'm just going to bring something up. So, can you see this? Let's see. It
No.
might be visual right now. Okay, so on my phone, I have a Google phone. When I open up, say, a notes section, there is a microphone. And if you click on the microphone, it lets you dictate and it'll type what you speak. That's the one that I've found the best. I've also used ones where you just do your audio and then it translates. It's not as good, again, as I've found. The best phone that I've found is the Google Pixel. So when I was having all my hand problems, I had an iPhone and I was having a lot of trouble dictating. So I did a huge search on what was the best phone, and the Google Pixels have the best dictation for audio dictation that I found. And I've been really impressed with it being able to pick up my voice and get my words accurate. I'd say it's about 92 to 95% accurate. So I do have a few words I have to change once in a while, but nothing like a lot of the phones out there. Yeah. Does that help? Yeah. Okay. Great.
As mentioned, we will put the slides, I will send the slides out as well as the recording of this webinar, so it's all accessible. You are welcome to reach out to myself or any of the artists that spoke on this call to continue building those connections and resources as well. Just a friendly reminder. Rare Artists does open on August 1st until September 13th at rareartist.org. These are our pieces that were awardees from this past year. If you have any questions about Rare Artist in general, feel free to reach out to me at rareartist@everylifefoundation.org. Again, that's rareartist@everylifefoundation.org, and I would be happy to help out. And lastly, I want to thank our sponsors who are supportive of this program to make all of this possible, including Amgen, WCG, Alexion, Harmony Biosciences, Ultragenics, and Biotechnology Innovation Organization. And with that, thank you all so much for being here today. It has been wonderful. Thank you all to Miriam, Megan, and Adair for all of your incredible knowledge and sharing this. As mentioned, the resource guide that we have is going to be an ongoing document. So if anybody thinks of anything that is not in that document and you think would be helpful to include, please reach out to me. I want to make sure that that's helpful for everybody. Have a wonderful rest of your day.